Hi guys. So what does a recovery after mommy makeover looks like? First of all, what is a mommy makeover? As most of you guys know, I do quite a bit of mommy makeovers, which generally involves a cosmetic operation on the breast, such as breast lift, reduction, or augmentation. It could be a combination of those procedures. In addition, it also involves a body contouring procedure such as liposuction, fat transfer, and tummy tuck. My makeover can last anywhere from 4 to 8 hours, depending on the extent of the operation required for individual patient. Recovery takes about 3 months until you're back to normal. However, the healing can take quite a bit of time, and the full result may not be evident until about a year or so. Okay, that's true for any surgery. It's not my rule, it's the nature's rule. Okay, so let's just go step by step and kind of discuss what do patients experience and what are some of the things we need to understand when it comes to this operation. Well, first of all, you will have a lot of swelling. Okay, most swelling will be present within the first week. That has to do with surgical trauma. As your body mobilizes fluid, there's some inflammation. Lymphatics get interrupted by making cuts, and so your body retains a lot of fluid. A lot of patients report weight gain and kind of that general discomfort. So what do we do about it? Well, first of all, we encourage patients to drink plenty of water, restrict their salt intake. I also encourage lymphatic massage for my patients starting about 2 weeks or so after surgery. That swelling, the good news, that swelling will go down. It will disappear as your body recovers. Okay. There are some sutures and staples also that may need to be removed. That generally happens within the first week or so. Our medical assistants are phenomenal. They're going to see you and will remove all those sutures and staples and likely tape the scar. Okay, that tape can also help to decrease the scar burden and further improve healing. We also recommend different creams such as elastin cream and then eventually silicone therapy after about 1 month. Then when it comes to activity and exercise, I generally tell my patients that they can start walking right away. Okay, that's important so you don't become deconditioned and prevent things like blood clots and just overall deconditioning and weakness. Walking, how much walking? Well, it depends. It could be anywhere from 10 to 20 minutes a day, up to an hour maybe for the first week, and then gradually more walking as the weeks go by. Light exercise can be started at about 1 month, and then you kind of slowly work up to more higher intensity exercise if that's what you're into. But that's something that shouldn't happen until about 3 months, especially if we do diastasis recti repair where we suture the rectus muscles kind of together, so to speak, and that takes time to heal, and it's important not to fully engage your core, do any kind of very high intensity lifting or exercise for the first 3 months to allow that area to heal well. Okay, nutritionally, I recommend high protein diet, avoiding excessive salt, and just overall balance. Okay. As far as medications and supplements, there's quite a bit of, we do give quite a bit of pain medications within that first couple of weeks. Generally try to avoid opiates as much as we can, but certainly other medications are okay, and we will prescribe you pain medications. In addition, certain supplements like arnica or Juven, which is an arginine supplement, are recommended to improve healing and decrease bruising. So that's really the recovery. First month is definitely the toughest, but most patients recover really well and are extremely happy with the results, but it does take time. Hope this was helpful. As always, we're here for you, and we want our patients to do their very best. And of course, if during your recovery, if there are any questions, you can always reach out to myself or our excellent medical assistants with any questions, and we'll be happy to address them.